Feel free to ask any questions you may have. They don't have to pertain to the topic for today. It's a topic that I feel extremely passionate about. Transform your doctor visits. So for the last 16 years of practice in Des Moines, Iowa, I've seen numerous thousands of patients with diabetes. And there are some common themes. There are some common problems that I see. And having seen these problems over and over, I've been so very interested in asking how can we change them? How can we change the doctor visits? But why is that important? Well, let's think about it for a moment. Life with diabetes is essentially 24/7, all the time, right? These 131,400 minutes every 3 months. And look at the doctor visit where you get the training and the resources that are necessary. That's just 15 minutes. Here's 15-minute here, another 15-minute here, and then in between these 131,400 minutes. Won't you want to use this time very, very well? Now contrast it to a soccer game or a football game. You train, 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 and then play. You train, 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 and you play. This is very different. In the sports of diabetes, you play, 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 train, play, play again. So this is why these 15 minutes are so important. And it is truly in your hands to make these 15 minutes count. Let's transform doctor visits together. And I'll show you some things that we can do. So here is a typical patient. Let's talk about Mike. Mike has a diabetes for 15 years. He has some complications. On a good day, he will get me some sugars and medications written out like this. On a bad day, he may not get any of this information, and then I'll be struggling to help him. When Mike goes back, he may not remember what I told him. He really can't afford his medications, and so he needs help. Does any of that ring any bell with you? I want you to think about your last doctor visit. What happened? How was it? Could it have been better? If any of those things echo with you, if you have any comments, feel free to mention your comments in the chat box. It's not just questions. You can mention your comments. What troubles did you have at your last doctor visit? How could it be made better? All right. So how can we help Mike? We can truly transform doctor visit. We'll talk about the common problems that happen at a doctor's visit, the solutions for them, especially what we can offer at My Diabetes Hope. We'll have some questions and answers at the end, but again, I'll take question answers in the beginning as well. And lastly, we'll look at some recent features that we've been very excited about and truly feel that they'll provide you value and help you change your diabetes. All right, let's look at a list of the common problems. And I'm sure there are more. And if I have not put your problem in, feel free to send that in the chat box, and I'll definitely answer that as well. So first thing is the sugar readings. I check them, but how do I organize them? How do I take them to the doctor's office? Trouble remembering your list of medications. Well, I take 7 medications, 11 medications. I can't keep up. How do I do that? I had a question, but I forgot what it was, especially because the doctor had 5 minutes for me and I just forgot all my questions. And then really, I get concerned about the time my doctor spends in collecting information. I'm there to see the doctor. I want face-to-face, one-on-one time, uninterrupted by anything else. But I find my doctor will spend a lot of time collecting information. So let's see if we can address some of these problems through some solutions. And again, Casey, anytime there's any comment, questions, feel free to interrupt and we'll talk about that as well. All right, let's look at the first thing. How do we organize sugars? I can't tell you how many times patients would come in without the sugars. And that really troubles me. You always, you go for your diabetes doctor visit, you got to take your sugars and then organize them in a good fashion that the doctor can make good decisions rapidly. So how would you do that? Well, that's where you can use My Diabetes Home. And if you do that and you bring the data to your doctor, he can make better decisions faster. You want the best out of your doctor visit. You want your doctor to be working at the highest level of their capacity. Their highest level of capacity is not data collection. Their highest level of work is to listen to you, understand what you are doing, where your sugars are, and offer you a treatment solution. I do have a couple of questions. Let me finish the sugar module, and then I will ask. So this is where in My Diabetes Home, you can manually track your sugars and put them in with the different times of the day. Again, it's made in a fashion that allows for the doctor to quickly look at it and even has a high-low function as well. You can, of course, add notes to all of this. And then My Diabetes Home converts this into a graph. Now think of Mike's blood sugars. They had all this number here, number there. I can make patterns, but when I look at this, I said, you know what? A lot of your sugars are running high before lunch. Let me fix that. So this picture is worth 1,000 words or 1,000 sugar readings. Not really, but yes, it does help me understand the picture much better. And then analytics, how about this information, especially like my estimated A1C that is 7%. I had a patient who used this information to time her back surgery because she could not get an A1C from the doctor's office because it was not 91 days. Well, let me pause here before I go to this. Well, let me say one more thing. Now, manual entry is hard. So you ought to be able to upload your meters. Great news for the last couple of months. We have been able to upload many sugars, the Freestyle, the Abbott Precision, Bayer Contour, and some of the one-touch meters as well. We recently added TrueMetrics. When you upload, it looks a little bit different with the x-axis being different and the graph looks a little bit different. But trust me, this is the kind of information I crave for from my patients, and I can just help them much better. I'm going to pause here and look at the chat window and see what questions I might have. So no sound, is that fixed? The audio?
I think that's just a problem she's having on her computer.
Okay,
We do
all
have
right.
a question.
Okay, go ahead.
Someone wants to know how many sugars they should bring to their doctor.
So the question is how many sugars to bring to your doctor's office? Here's the thing to think. I like to see at least 2 weeks. That's for most of my patients. I'm an endocrinologist, so my patients are checking blood sugars 2, 3, 4, 5, 6, 7 times a day. 2 weeks in general gives me a good idea, but I have some patients who are checking once a day. In that setting, I like to see about a month. The more you take, the better it is. With My Diabetes Home, you don't have to worry about how long. You'll have your device with you. They can look as far back as they want. But 2 weeks is a good amount. How often should you check sugars? A very simple rule I have, one more time than the number of shots, insulin shots you're on each day. So if you're on pills, about once a day. If you're on 4 shots of insulin a day, about maybe 4 or 5 times a day. Well, thank you for that question. Let's keep moving. All right, second big problem that's a huge time waster and is a massive safety issue as well. If I don't have the right list of medication for you, how do I change that? So it's so important that your doctor knows the medications you are taking. Sometimes I'll see these lists, some days I won't even see this list, and that makes it really hard. So with My Diabetes Home, you can really organize all your medications and get the benefit, avoid miscommunication, avoid the errors. Is there a question?
There's another question.
Sure.
Joseph on Facebook wants to know, what are the effects of diabetes on mental health, if there are any?
Okay. Joseph, thank you for the question. Diabetes is a 24/7 intense disease. Depression and chronic psych illness are more common in patients with diabetes. And it is a vicious cycle. The stress of diabetes, the mental illness on top of that, then you don't take care of your diabetes, stress levels go higher, you get more depressed. It's a vicious cycle. This is where working with your doctor and being upfront about how you are feeling about your disease is very important. Make sure to talk to them about, I feel sad, I don't feel like doing it, I'm angry at diabetes. Whatever that is, you got to share. And then your doctor can address some of it or help you with a health psychologist or a behavioral therapist. Thank you. Back to then our list, my medications. This is the next piece of information that's exceptionally powerful. There's a video from Dennis you can see on our website where how it helped his care in the ER. He had significant back pain, could not speak, and then he was able to just pull his smartphone with his med list. You put it in one, it's always with you. This is an exceptionally important part. The other thing is your doctor needs this, take it there. And then not only that, on your medications, you can also know about a whole bunch of money-saving options. Any of you having trouble affording your medications? Just chat in the window. What do you feel about the cost of medications? Chat it in. Tell me what you feel about the cost. And we are trying to solve this problem. We have our own drug discount card and so forth. So that's the second big component. The third thing, I personally have done it many times myself, is I had a question, I thought about it, I went to the doctor's office, I waited inside the doctor room for about 15 minutes. When the doctor came in, he was in a rush. He quickly went through his 5 things, and here I am at the end. Oops, shoot. I should have asked that question. Well, let's never do that again. Your question comes in, you write insights, you write somewhere, and never forget. Get your question answered. It's your diabetes, it's your appointment. Make the best out of it. Take your questions in. So your questions you can record anytime at My Diabetes Home in the pre-visit questionnaire at the bottom of this questionnaire. And these questions will then populate into your doctor's visit whenever you are seeing them next time. So that's very important as well. Lastly, I think there's this one more thing. Diabetes 24/7, a lot of numbers, sugars, medications, A1C, blood pressure, cholesterol, all of that. I and my staff waste a lot of time collecting information. So help them by collecting this information proactively so that they have to spend less time collecting your information, and then they can give you more one-on-one time. They listen to you, they connect, they understand. When all of that happens, they are going to give you better advice and a better prescription. This is where it all comes together. It's called the Visit Optimizer tool. This brings everything together, your current med list, and it saves the doctor a lot of time. I've had several patients now who have taken this Visit Optimizer in the doctor's office. And I'll tell you 3 things that I remember. One of them comment said, my doctor looked at it and just simply smiled at me. Another one said, the doctor said, where did you get this? The third one said, how did you make this? This is everything. I've seen all these problems for 15 years, 21 years, frankly, and I've been trying to solve those. So all the things that your doctor needs will be in one place. And remember, all of this can be connected to your EMR, to your pharmacy, so the data can come in automatically. So your medications, all your important numbers, your last doctor visits, and not just the numbers, the trend, the colors, all of that, the doctor can see. Your sugars, your questions, and analyze and understand your sugars. See your estimated A1C. So that's another piece. So these are some of the major problems. If we can have all the information available to our doctor, namely sugars, medications, my numbers, very well organized in a tool like Visit Optimizer, they will be thankful and happy. And they say, happy doctor, happy you. Much better doctor visits. So I'll pause here before summarizing and going to some of the recent things we are excited about. But I wanted to see if there are other questions. Is there something I haven't talked about?
There's no more questions yet, but I can watch the poll.
Okay, no more questions as yet. Again, if you have any comments or thoughts on what of this do you find useful, not so useful, please do let us know. Okay, so there's a poll that's going to show on your screen. While you fill that, I'm going to summarize. Here's the summary. Be ready for your doctor visit. Make the most out of your doctor visit. So first of all, take your sugars with you. Very important. Take your list of medications with you. Take your questions with you. Prep your questions, take them with you. Don't rely on memory. It's a very fast 5 minutes with your doctor. And use a tool like Visit Optimizer to really get the most out of your doctor visit. All right, well, thank you very much for sharing. Casey, you have another question? Please go ahead.
Are there specific questions a patient should always ask their doctor at every appointment?
Okay. So the question is, are there any specific question that I should be asking my doctor? So apart from the thing that you mentioned here, there's one thing I did not touch on. That's the preventive stuff that's needed. And this reminds me of a few things you want to think about. With your diabetes doctor, especially the vaccines. Hey, am I updated on my flu shot, pneumonia shot, shingles shot? And one day we'll do a vaccine and preventive. What are the things that patient need? So one of the webinars in the future months, we can talk more about it. Foot exam, eye exam, these are some of the things that you need to know. And that's something I would ask. I think it'll be worthwhile from time to time to make sure to talk to them about, hey, how's my kidney function? Is my medication dose right for my kidney function? As we get older and we get longer duration of diabetes, our kidney function declines. And it's very common for physicians to not think about changing and reducing the doses of medications. I would ask that. I would ask, do I need a cholesterol medicine? Do I need an aspirin? These are the other few key things to remember to get the most out of your doctor visit. Great question, and I think there are many other things. And as we move forward, we'll make the Visit Optimizer have some of these care alerts in as well. So stay tuned for that. All right, we are getting closer to the end of our time together. I am really, really glad you guys joined. You're proactive. You want to take better care of your diabetes, and that's very important. Let me spend the last few minutes on some things that I think will add value and will provide you much help. So I am on the site. There are several videos that we have been put together for you. What's an A1C? How to get the most out of the doctor visit? What should my sugar targets be? And things like those that are available. Remember, you can add your Fitbit, your Apple Watch, your Misfit, any of those devices to My Diabetes Home, and you can really see them very easily in My Diabetes Home. There's this one single score called Diabetes Score. Too many numbers in diabetes. We combine it into one single number. If this single number is really good, guess what? Several years down the road, you will have much lesser cost of medications, hospitalizations, and you'll have much better health. So these are all the fitness trackers that you can add. Fitbit, Misfit, I'll strongly recommend you go today. Make it a goal today itself. Connect your device. Go connect your device and let the data come in. Eventually, we'll connect it to your sugars. It will show you how activity is affecting your sugars.